If you've been looking for a simpler way to get a GLP-1 medication like Zepbound, Wegovy, or the fairly recently approved Foundayo, CVS just announced some major changes that could make the process easier and potentially less expensive for many patients. The company has revamped its weight management program with new telehealth options, expanded pharmacy support, and a new partnership with Eli Lilly. But there are a few important details that aren't obvious in the headlines. Let's break down exactly what's changing, who qualifies, and whether this could actually save you money. CVS is trying to become a one-stop shop for people using GLP-1 medications. Instead of having to piece everything together on your own, from finding a prescriber to figuring out insurance coverage to locating a pharmacy that actually has your medication, they are combining those services into one system. The biggest announcements include a new $29 virtual weight loss visit through MinuteClinic, expanded pharmacist support, a new collaboration with Eli Lilly, better price transparency inside the CVS app, and continued participation in the Medicare GLP-1 Bridge Program. Let's go through each one. Probably the biggest headline is the new MinuteClinic online visit. For $29, eligible patients can schedule a virtual appointment with a licensed clinician 24 hours a day. During that visit, the clinician reviews your medical history and determines whether a GLP-1 medication is appropriate for you. If it is, they can prescribe one when clinically appropriate. What's nice is that there isn't a membership fee. Many online weight loss services charge monthly subscription fees just to maintain access. CVS says this is simply $29 per visit with no recurring membership. Follow-up appointments are available if you need medication adjustments, help managing those side effects, or even ongoing monitoring. However, there are some limitations. Right now, this program is intended for adults between 18 and 64 years old who are paying out of pocket for the clinical visits. If you're on Medicare, this particular telehealth option generally will not apply to you. CVS is also partnering directly with Eli Lilly. If you're prescribed Zepbound or Foundayo, you'll eventually be able to see your pricing directly inside the CVS Health app. CVS says by early fourth quarter of this year, eligible patients will be able to view insurance pricing, cash pay pricing, and available savings options before they even pick up their prescription. The goal is to eliminate some of the confusion around what you'll actually pay. And if you've ever stood at the pharmacy counter wondering why today's price is completely different than last month's, you know how frustrating that can be. Another benefit is convenience. CVS says eligible patients will be able to use the app to check pricing and pick up medications the same day at more than 9,000 CVS pharmacy locations. Instead of relying exclusively on mail order pharmacies, patients will have the option to pick up their medication locally. For some people, especially if you're starting treatment quickly or you need your next refill, that could be a significant advantage. CVS also emphasized that it now carries every FDA-approved GLP-1 medication for weight management. That includes injectable options like Wegovy and Zepbound, as well as the newly approved oral medication Foundayo. Of course, availability can still vary by locations, but CVS says patients can access both injectable and oral GLP-1 medications through their pharmacies. Now let's talk about the question everyone asks. How much will this actually cost? The answer depends entirely on how you're paying. If you have commercial insurance and qualify for manufacturer savings programs, some patients may pay as little as $25 per month. For certain cash pay options using manufacturer vouchers, CVS says qualifying patients may be able to access some medications for around $149, depending on the medication and, of course, the dose. Of course, not everyone will qualify for those prices, so it's important to check your own eligibility. Now, here's the part many of you have been asking about. CVS also reminded everyone that it participates in the Medicare GLP-1 Bridge Program. If you are eligible for that program, qualifying Medicare beneficiaries can obtain certain GLP-1 medications for $50 per month through participating pharmacies, including CVS. That program currently runs through December 31st, 2027. If you've been following my channel, you already know we talk quite a bit about the Medicare Bridge Program here, and this announcement simply confirms that CVS continues to participate. So this announcement is not about introducing brand new medications. It is more about simplifying the entire process. One of the biggest frustrations that people tell me about isn't necessarily getting a prescription. It's figuring out who can prescribe it, what insurance covers, where it's actually in stock, which coupons work, which ones don't work, and how much they're going to end up paying. CVS is clearly trying to put all of those pieces together into one connected experience. Whether it ends up being easier in real-world use remains to be seen, but having additional options is generally good news for patients. As always, remember that eligibility for GLP-1 medications depends on your medical history and your healthcare provider's evaluation. Not every medication is appropriate for every person, and pricing can vary quite a bit depending on insurance, manufacturer programs, and whether you're paying cash. I would love to hear from you, of course. You guys are a great resource for me. Would you consider using CVS's new weight management program? Have you already been using MinuteClinic or CVS Pharmacy for your own GLP-1 prescriptions? Let me know your experiences down in the comments. I'm sure we would all love to hear how things have been for you. And if you found this update helpful and you want to stay informed on the latest GLP-1 news, medication updates, Medicare changes, and emerging treatments, don't forget to like this video, subscribe to the channel, and I will see you in the next one.